The central message of our study is that disaccharidase deficiencies are highly prevalent among patients who undergo upper endoscopy for gastrointestinal symptoms. Yet most of these patients do not exhibit structural intestinal histological changes or develop inflammatory gastrointestinal diseases over time. Hello everyone, my name is Sameer Rao and I'm an internal medicine resident at Rutgers, New Jersey Medical School and former postdoctoral research trainee and now research collaborator in the Division of Gastroenterology and Hepatology at Mayo Clinic. I'm delighted to share findings from our research titled Clinical Insights into Disaccharidase Deficiency, Prevalence, Intestinal Histology and Outcomes, which will appear in Mayo Clinic Proceedings December 2025 issue. This work was conducted under the supervision of Dr. Madhusudan Grover and our multidisciplinary team, including experts from laboratory medicine, pediatrics, and gastroenterology at Mayo Clinic in Rochester, Minnesota. To give a brief overview, this was a retrospective study which included 6,691 patients who underwent disaccharidase activity assay on duodenal biopsy samples at Mayo Clinic from 2011 to 2024. The disaccharidase activity panel assay included lactase, sucrase, maltase, palatinase, and glucoamylase. Let's start off with a background on disaccharadases. They are brush border enzymes responsible for digesting complex sugars into absorbable monosaccharides. Their deficiency can cause abdominal pain, bloating, gas, and diarrhea, symptoms that can closely mimic disorders of gut-brain interaction such as irritable bowel syndrome. The data on prevalence and outcomes of these disaccharidase deficiencies, especially in adults, are quite limited, and that gap motivated us to conduct this research project. In our study, we categorized patients into three major groups based on the results of disaccharidase assay. First group was those with normal enzyme activity. Second group was those with isolated lactase deficiency, and third and the final group was those with other patterns of deficiency, including but not limited to pan-disaccharidase deficiency, where all measured enzymes were low. Among our total cohort, about 41% patients had some form of deficiency, in which isolated lactase deficiency was the most common one, seen in about 26% of patients, and in the remaining 15% patients, we had other deficiency patterns, including roughly 8% with pan-disaccharidase deficiency. Importantly, in that group of patients with other deficiency patterns, when we reviewed duodenal histology, nearly every 3 out of 4 patients had normal biopsy, meaning that there was no villus atrophy or any sign of inflammation. We also looked at patients who underwent repeat disaccharidase testing with a median follow-up of about 3 years. Interestingly, about half of lactase deficiency persisted, while only a small fraction of sucrase, palatinase, or maltase deficiencies did. Finally, to examine whether disaccharidase deficiency predicted future gastrointestinal diseases, we followed over 750 patients who did not have celiac disease or inflammatory bowel disease at baseline. Over the median follow-up period of 31 months, only one patient developed celiac disease and three developed Crohn's disease, which is very similar to the rates seen with general population. The study was uniquely possible because of Mayo Clinic's integrated clinical and laboratory infrastructure. And in terms of clinical relevance of the study is firstly, an abnormal disaccharidase assay do not automatically imply structural intestinal disease. As we saw, many patients with enzyme deficiencies, even pan-disaccharidase deficiency, have normal mucosal architecture. Secondly, clinicians should always interpret these results in the broader context of patient symptoms because the manifestation of enzyme deficiency overlaps significantly with disorders of gut-brain interaction, as we spoke earlier. So testing should be selective and always correlated with clinical history. Many patients can be managed effectively through targeted dietary changes such as limiting lactose or sucrose, and in select cases, enzyme supplementation could be helpful. Thirdly, and most important one is that recognizing the possibility of false positive results. due to handling or storage error is essential, particularly when all the enzyme levels are uniformly low. Going forward, our group aims to understand why the majority of individuals exhibit disaccharidase deficiencies despite having normal intestinal histology, as these high rates are unlikely to be fully explained by primary genetic causes alone. Future studies at Mayo Clinic aim to investigate whether previously unidentified histological changes associate with enzyme deficiencies on biopsies. In summary, our research reveals a high prevalence of disaccharidase deficiencies among patients with GI symptoms undergoing upper endoscopies. These deficiencies, however, do not predict development of a future inflammatory GI disorder. We invite you to read our full article in Mayo Clinic Proceedings for a detailed analysis of enzyme activity patterns, histological correlations, and clinical outcomes. Thank you everyone for watching.
We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com Mayo Proceedings, or journal updates on Facebook, www.facebook.com Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.